everyone. I'm Dr. Jake, and this is Faith, one of our patients. We're actually going to demonstrate a Webster Technique chiropractic adjustment today. But before we do that, I want to explain a little bit of where we're at with Faith. So Faith has been adjusted here for years, right? With Dr. Josh.
So I was a teenager.
Since you were a teenager. And so she's been coming regularly, and she just got introduced when she got pregnant to the Webster Technique, right? And so, Faith, what is the difference, because you were adjusted before?
Sure.
What is the difference with the Webster Technique versus what you were adjusted, and how has the Webster Technique helped you the most?
Yeah, so I would say it's a lot more in depth and really specific to the hip areas, all things baby. It's a lot more stretching, and it's helped a lot. So I first came to you and I had some sciatic, the baby was sitting on my nerves wrong. So I had some sciatic pain, like going all the way down my leg. And it seemed like after 2 or 3 weeks, it was gone, which was awesome. So y'all target people need to come. To come see Dr. Jake.
Exactly. So in number one, like the pelvis, right, alone, it was very misaligned. Just for your guys' information, her pelvis was really misaligned, and because of that, it was putting pressure on that sciatic nerve, which was going down her leg, and we were able to correct that and help baby get in a better position forward.
Yep.
And the stretching as well has really been beneficial for you too, which is great. Things you can do at home as well that she's done with her husband is stretching and other things that we can help her in that process all the way clear up until delivery, which she's 37 weeks today, 37 weeks in a few days, which she's going to come here soon. And another thing to mention, she will be, coming back after.
Oh, yeah.
And getting postpartum adjustments, which is good for the healing process after delivery. Better?
Yeah, that's cool.
Okay. So with Webster Technique, as I'm going through like this, so it's interesting as baby grows, they change, and Faith's presentation has actually changed. So with this, her leg doesn't go far enough on that right side, and so that tells me that this side is tighter, so we got to address that. And this is the SI joint that we're going to be addressing, and this is right through here. So we use the drops on this, okay, which that's why we have her on the pillows to protect baby, but then we can still use the drops to drop on that. And so we're coming through here and we're actually correcting the pelvis here. So because of that leg check that I just did, this shows that her right side is tight today. And so what I'm doing there is I'm actually helping this right side with my hand, getting that pelvis back in the right place and helping that correction happen. Now see how her legs are even through that. And did you have any pain, Faith, in the back?
Just a little bit right here.
Still?
Mm-hmm.
Not too bad. In better words, Faith.
Oh, that's good.
Better?
Yep.
Good. All right, so that's the first step. That's the bone, moving the bone. The muscle that we deal with the Webster Technique is the deep glute muscles, okay, which can throw the pelvis out. And so now what we're going to do is we're going to trigger point some of these very inner glute muscles and stretch those out. And as I'm doing this, she's taking deep breaths and helping bring oxygen to those muscles. And we're trying to get those muscles to relax a little bit better because they get a little bit tight during carrying baby all the time. Alright, so that was muscle. Now ligament, there's a ligament that goes from the tailbone to the sitting bone, okay? And this one is called the sacral tubulus ligament. And when during pregnancy, when things are all moving around with the pelvis and everything, it's key that we get that leveled and get that to where it's that release, that tightness in the pelvis. So I'm gonna touch your tailbone. You okay with me, Faith? Touch tailbone.
Go right ahead.
And then come down here, and then I'm coming to the opposite side of where she was tight on. So she was tight on this side. So because of that, I'm gonna go on the opposite side, on the left side today. Okay. And then I'm gonna have her give a cough. And that helps me to find where we need to be. Give it one more time. Good. And then we take deep breaths. What we're doing here is we're trying to get that to release and get some of these lower back muscles to unspasm. Take deep breath in and breathe out. Good. As you're further along in pregnancy, we want to move the pelvis, right? But we can't just do the regular side posture that we always do with the leg, you know, like this, as I'm coming through. We can't do that anymore because baby's too big, right?
Right.
And so we can't do that. And so this is a modification of the side posture to help move the pelvis a little bit more. So this is where I come in through here, arms this way, and I'm coming through here and take deep breath in and breathe out. Good. Good. In.
Ooh, that felt good.
And breathe out. Good. In. And breathe out. Now with Webster Technique, it's bone muscle ligament on the front. So bone muscle ligament, bone is the pubic bone in the front. So I come here with her hand and we touch just right or left, feel more tender.
It could means to be a little low. Oh, right, definitely.
Right, okay. Okay, then we come here and I replace my hand with hers. And then we're coming here, doing a little waggle. Let me know if it's too much and I'll back off. But we're putting pressure on the pubic bone, which is in the front of the pelvis, to kind of get a little bit of pressure off of that, well, where baby's sitting. He's very low.
Uh-huh.
And so it's a little bit uncomfortable. So bone, then muscle. So how we test the muscle on the front is actually the psoas muscle that goes through clear down to the hip. So in order to test that, we're going to do this. So take deep breath in, together, and then she does this chair pose. Okay, and then but that tells me, because she's a little bit short on this one side. Okay, she puts her fingers together, see how it's shorter on this side, which tells me that this side that's short is tight for her today. So we're coming through here.
Oh yeah, it's definitely tight.
Feeling it?
Yep,
Hey.
like all around the hip.
Okay, breathe, give me some good oxygen. And then to add to it a little bit, I do some trigger pointing right in the psoas muscle, which these are the hip hikers, or the muscles that use your leg to come up. And so as I'm doing that, I'm trigger pointing those, she's breathing, and deep breath in, and breathe out. Good. And as you can see, it's even, which is cool. Now with this is the last one. So that was muscle. So we did bone, muscle. The last one is ligament. So ligament is the round ligament, and when you're pregnant, as Faith can attest, it becomes a whole lot more of a bigger problem.
Yeah, it does.
Right? So and that's usually right underneath where you have in the Braxton Hicks, right? It's right underneath in the belly, and it comes up and it actually attaches to the pelvis. So what we're going to do is we're going to put some pressure on that to level it out, and it's usually opposite of the side that I trigger point so that it's tight. So what we do is I have her point to her belly button for me. And what we do, and you can come around here, you can see it a little bit more. What we do is 45-degree angle down, and I'm coming 45-degree angle down this way. So it's kind of like making a box, and then we find right underneath the belly is that the tender spot.
Oh yeah.
Okay? And what I'm doing is I'm pushing up and opposite to the opposite shoulder, so which gives some pressure on that that round ligament, which is holding baby. And sometimes I'll get kicked. This is one thing that helps with the legs and the lower back is the stretching. So we're going to do some stretches, which she is really beneficial of. Is these stretches in the hips. So what I'm doing is I'm pulling this leg towards this one. She does it 25% of her power. 3, 4, 5, 6, 7, 7 to 7. So it's a little bit further. Push 1, 2, 3. 7, release, and rise. 1, 2, 3, 5, 6, 7, and rise. Dip. We're coming up and out. Push back.
This one just, all of this gives such relief to my hips.
Yep. We'll push down. 1, 2, 3. We're basically stretching all the muscles around the leg.
Ooh, that one's in the head today.
And then we're coming up. No pressure on baby. We're okay?
Yep, we're good there.
Good. Push. 1, 2, 3. Keep coming this way. This way. Okay, so this is a good one for the front ones. So I'm coming here, bracing her back with my hip. And we're gonna come here, about like that. And she's gonna try and pull up. Go ahead, 1, 2, 3, 4, 7, and relax. And relax. Good. Alrighty.
Awesome.
I'm gonna come on up.
Yep.
Sometimes, depending on the woman, right? She has some swollen wrists, so we do some wrists.
Yeah, if anything's hurting on you ladies, just let him know, and then it seems like you got an adjustment for it.
True. Pretty much.
Oh yeah, it's
Had
nice.
some, yeah, she has some tight wrists. We've had some shoulder that come in. I've had elbows, ankles, all sorts of different things. And my wife, she had miserable pregnancies, and so I'm so glad that I was able to get this training to help women through pregnancy when they're having a miserable time anyways. Growing a human being, it's not easy.
No, it's not. Worth it though.
It is. 'Cause then you have a baby at the end.
Well, this was helping my wrists. They were just completely locking up sometimes, but it seems like that happens very infrequent after.
After we started doing that.
Yeah,
Good.
still happens, but it's way less.
It's more manageable. And that's because, you know, with pregnancy, water weight, and we got water accumulation and stuff like that. Okay.
Much so.
Netta,
Thank you.
no problem.